What is angina? Angina is chest pain that happens because there isn't enough blood going to part of your heart. It can feel like a heart attack, with pressure or squeezing in your chest. It's sometimes called angina pectoris or ischemic chest pain. It's a symptom of heart disease, and it happens when something blocks your arteries or there's not enough blood flow in the arteries that bring oxygen-rich blood to your heart. With angina, pain in your chest can spread to your shoulders, arms, neck, throat, jaw, or back. Angina usually goes away quickly. Still, it can be a sign of a life-threatening heart problem. It's important to find out what's going on and what you can do to avoid a heart attack. Usually, medicine and lifestyle changes can control angina. If it's more serious, you may need surgery. Or you may need what's called a stent, a tiny tube that props open arteries. Angina versus heart attack. Heart disease can also cause a heart attack. The decrease in blood flow to your heart in a heart attack is longer than that in angina. This causes part of the heart muscle to die, which is permanent damage. The drop in blood flow to your heart in angina is short, so it doesn't cause permanent damage. Angina types. There are different types of angina. Stable angina. This is the most common type of angina. Physical activity or stress can trigger it. It usually lasts a few minutes, and it goes away when you rest. It isn't a heart attack, but it can be a sign that you're more likely to have one. Tell your doctor if this happens to you. Unstable angina. You can have unstable angina while you're at rest or not very active. The pain can be strong and long-lasting, and it may come back again and again. It can be a signal that you're about to have a heart attack, so see a doctor right away. Microvascular angina. With microvascular angina, you have chest pain but no coronary artery blockage. Instead, it happens because your smallest coronary arteries aren't working the way they should, so your heart doesn't get the blood it needs. The chest pain usually lasts more than 10 minutes. This type is more common in women. Prinzmetal's angina. This type of angina is rare. It might happen at night while you're sleeping or resting. Your heart arteries suddenly tighten or narrow. It can cause a lot of pain, and you should get it treated. Angina symptoms. Chest pain is the symptom, but it affects people differently. You may have aching, burning, discomfort, dizziness, fatigue, feeling of fullness in your chest, feeling of heaviness or pressure, upset stomach or vomiting, shortness of breath, squeezing, sweating. You might mistake an aching or burning for heartburn or gas. You're likely to have pain behind your breastbone, which can spread to your shoulders, arms, neck, throat, jaw, or back. Stable angina often gets better with rest. Unstable angina may not, and it could get worse. It's an emergency that needs medical help right away. Angina symptoms by sex. Men often feel pain in their chest, neck, and shoulders. Women may feel discomfort in their belly, neck, jaw, throat, or back. You may also have shortness of breath, sweating, or dizziness. One study found that women were more likely to use the words pressing or crushing to describe the feeling. Heart attack symptoms. You get a heart attack when blood flow to your heart muscle gets restricted or blocked, often by a clot in an artery. Without oxygen, your heart muscle gets damaged or could even die. A 2008 study in the American Journal of Critical Care found that chest pain is the most frequently reported heart attack symptom, and 61% of 256 participants said their symptoms were constant. Your chest pain may feel like discomfort, pressure, tightness, burning, fullness, squeezing. If you've not experienced it before, patients often aren't sure what it is when it first comes on, says Kristen Newby, MD, a cardiologist at the Duke Heart Center in Durham, North Carolina. The same study found that women were about 8 years older than men when they began to have heart trouble and were more likely to report a higher intensity of 5 other symptoms: indigestion, palpitations, nausea, numbness in the hands, unusual and overwhelming fatigue. The study found that 21% of women and 10% of men had no symptoms. Less typical symptoms for both men and women are discomfort in the neck, arms, jaw, back, or stomach, shortness of breath, dizziness, cold sweat. Men and women may respond differently to the symptoms of a heart attack, particularly if the symptoms are vague. But if you have symptoms consistent with a heart attack, don't wait at home. Go to the hospital, says Alfred Sacchetti, MD, an emergency room doctor. Angina causes. Angina usually happens because of heart disease. A fatty substance called plaque builds up in your arteries, blocking blood flow to your heart muscle. This forces your heart to work with less oxygen, which causes pain. You may also have blood clots in the arteries of your heart, which can cause heart attacks. Less common causes of chest pain include a blockage in a major artery of your lungs, an enlarged or thickened heart, narrowing of a valve in the main part of your heart, swelling of the sac around your heart, tearing in the wall of your aorta, the largest artery in your body. Angina risk factors. Some things about you or your lifestyle could put you at a higher risk of angina, including older age, family history of heart disease, high blood pressure, high cholesterol, diabetes, obesity, stress, smoking, not getting enough exercise. Angina diagnosis. Your doctor will do a physical exam and ask about your symptoms, risk factors, and family history. They might need to do tests including EKG. This test measures your heart's electrical activity and rhythm. Stress test. This checks how your heart is working while you exercise. Blood tests. Your doctor will check for proteins called troponins. Lots of them are released when your heart muscle is damaged, as in a heart attack. Your doctor may also do more general tests like a metabolic panel or complete blood count. Imaging tests. Chest X-rays can rule out other things that might be causing your chest pain, like lung conditions. Echocardiograms and CT and MRI scans can create images of your heart to help your doctor spot problems. Cardiac catheterization. Your doctor inserts a long, thin tube into an artery in your leg and threads it up to your heart to check your blood flow and pressure. Coronary angiography. Your doctor injects dye into the blood vessels of your heart. The dye shows up on an X-ray, creating an image of your blood vessels. They may do this procedure during cardiac catheterization. Angina questions for your doctor. Do I need any more tests? What type of angina do I have? Do I have heart damage? What treatment do you recommend? How will it make me feel? What can I do to try to prevent a heart attack? Are there activities I shouldn't do? Will changing my diet help? Angina treatment. Your treatment depends on how much damage there is to your heart. For people with mild angina, medicine and lifestyle changes can often help their blood flow better and control their symptoms. Medicines. Your doctor might prescribe medicines including nitrates or calcium channel blockers to relax and widen blood vessels, letting more blood flow to your heart. Beta blockers to slow your heart down so it doesn't have to work as hard. Blood thinners or antiplatelet medications to prevent blood clots. Statins to lower your cholesterol levels and stabilize plaque. Cardiac procedures. If meds aren't enough, you may need to have blocked arteries opened with a medical procedure or surgery. This could be angioplasty, stenting. The doctor threads a tiny tube, with a balloon inside, through a blood vessel and up to your heart. Then, they inflate the balloon inside the narrowed artery to widen it and restore blood flow. They may insert a small tube called a stent inside your artery to help keep it open. The stent is permanent and usually made of metal. It can also be made of a material that your body absorbs over time. Some stents also have medicine that helps keep your artery from getting blocked again. The procedure usually takes less than 2 hours. You'll probably stay overnight at the hospital. Coronary artery bypass grafting or bypass surgery. Your surgeon takes healthy arteries or veins from another part of your body and uses them to go around the blocked or narrowed blood vessels. You can expect to stay in the hospital for about a week after you have this. You'll be in the intensive care unit for 1 or 2 days while nurses and doctors keep a close eye on your heart rate, blood pressure, and oxygen levels. You'll then move to a regular room to recover. Enhanced external counterpulsation, EECP, may be an option to relieve your angina. Your doctor may recommend it if other treatments haven't worked or aren't right for you. EECP uses several blood pressure cuffs on both legs to gently, but firmly, compress the blood vessels there to boost blood flow to your heart. Each wave is timed to your heartbeat, so more blood goes there when it's relaxing. When your heart pumps again, pressure is released right away. This lets blood to be pumped more easily. It can help your blood vessels make a natural bypass around narrowed or blocked arteries that cause your chest pain. It may help some small blood vessels in your heart open. They may give more blood flow to your heart muscle to help ease your chest pain. You might have EECP if you have chronic stable chest pain. Aren't helped by nitrates, calcium channel blockers, and beta blockers. Invasive procedures like bypass surgery, angioplasty, or stenting aren't right for you. EECP isn't invasive. If you're accepted for EECP treatment, you'll have 35 hours of therapy. It's given 1 to 2 hours a day, 5 days a week, for 7 weeks. Studies show its benefits include less need for angina medicine, fewer symptoms, and the ability to be more active without symptoms. Angina outlook. Angina raises your risk of having a heart attack, but it's treatable. Consider it a warning sign and make healthy choices. Talk with others who have it. This may help you learn how to feel better. Your family, too, may need support to help them understand your angina. They'll want to know what they can do to help. Lifestyle changes. You can still be active, but it's important to listen to your body. If you feel pain, stop what you're doing and rest. Know what triggers your angina, like stress or intense exercise. Try to avoid things that tend to set it off. For example, if large meals cause problems, eat smaller ones and eat more often. If you still feel pain, talk to your doctor about having more tests or changing your medications. Because angina can be a sign of something dangerous, it's important to get checked out. These lifestyle tips may help protect your heart. If you smoke, stop because it can damage your blood vessels and increase your heart disease risk. Eat a heart-healthy diet to lower your blood pressure and cholesterol levels. When those are out of normal range, your chance for heart disease can rise. Eat mainly fruits and vegetables, whole grains, fish, lean meat, and fat-free or low-fat dairy. Limit salt, fat, and sugar. Do things to cut down on stress like meditation, deep breathing, or yoga to relax. Exercise most days of the week. See your doctor regularly. If you have chest pain that is new or unusual for you and you think you may be having a heart attack, call 911 right away. Quick treatment is very important. It can protect you from more damage. Takeaways. Angina is chest pain that happens when the flow of blood to your heart briefly decreases. Angina does not cause permanent damage to your heart like a heart attack does. It can be treated with medication or medical procedures like having a stent or a tiny balloon to help open the arteries. Sometimes, coronary bypass surgery is needed. Getting exercise, eating a nutritious diet, and watching your stress level are among the things you can do that can help keep your heart healthier. Angina FAQs. Does angina mean a heart attack? Angina means chest pain. It can sometimes signal a heart attack. Angina can be a sign of very serious heart issues. When you have chest pain, it's important to see a doctor right away. How can I remove gas trapped in my chest? Gas can get trapped in your digestive system if you can't burp it out or pass it out. Sometimes, if it's in the upper part of your digestive tract, it can make your chest hurt. You need to find out the source of any of chest pain you may have. If you're having other symptoms that might mean you're having a heart attack or angina, get medical help right away. Chest pain from gas can come after you eat or drink something that causes the gas to form. Burping or passing the gas is the fastest way to get rid of it, but if it's trapped, you might try a heating pad to help relax your belly area. Over-the-counter anti-gas medicine with simethicone, ginger, in tea, candied, or even ginger powder in water. Gently rubbing your belly. Easy exercise, like walking or yoga poses.